So you got some news today that you weren't too excited about, and that was one of your family members tested positive for COVID-19. So now what do? You're sharing space, right? And there's all these great recommendations that are coming out in terms of quarantine and time, but is there anything that you can do health-wise, supplement-wise, to keep you from then contracting COVID-19, or at least if you have to get it, right? Unfortunately, keep it at bay so that the symptoms aren't so bad. Well, basics, right? We've talked about these before in other videos, but vitamin D, vitamin C, zinc, quercetin, selenium, these are all great. Another great supplement would be NAC, especially if you have a history of any sort of respiratory disease, any sort of asthma or chest congestion. NAC, which is a amino acid which helps clear out the congestion, can be very beneficial too, especially since we're seeing, right, breathing disorders, trouble breathing, chest tightness along with this condition. NAC is a good one to throw in. And then certainly things like silver and elderberry, which are antiviral. They also help prevent what's called the cytokine storm, which occurs when the symptoms get really bad and out of control. And that's where we're seeing some of these people getting really, really, really sick versus some, mild symptoms that don't feel good when you're going through them, but on the back end aren't so terrible. And certainly there's things like arabinox, which are arabinogalactans that boost the immune system, that can be taken. We use things like biocidin as well to treat. All of these things can help keep it at bay, because you also might have it and not even know it, right? It may be that you haven't got the symptoms yet and we need to knock those out before they even manifest, or that you are truly asymptomatic and you don't want to get other people sick in the home. So all of these things can be taken once somebody in the house actually has the symptom or tested positive for it, so that you protect yourself not only on the front end of not getting it, but should you, to help make it easier to move through.